Good morning or good afternoon, everyone. Thank you so much for joining us today. My name's Jen Kozalina from Cedars-Sinai Medical Center, coming to you as a representative from NETEC. We are excited to bring to you our latest webinar, PPE from A to Z, exploring the latest standards and regulations for healthcare personnel, PAPRs for respiratory protection. So just a little bit about NETEC. NETEC's mission is to set the gold standard for special pathogen preparedness and response across health systems in the U.S. with the goals of delivering best practices, closing knowledge gaps, and developing innovative resources. And we accomplish this mission through the collaborative efforts of 13 regional emerging special pathogen treatment centers across the country. We have more than 100 industry leaders representing a range of healthcare professions, from infectious disease clinicians to emergency medical service leaders, and we share our expertise across NETEC's 15 national work groups and 9 task forces. NETEC leverages the knowledge and experience of its regional partners to produce timely and innovative educational resources, provide technical consulting services, and build a nationwide special pathogen research infrastructure and convene global partners. Just as a quick overview for today, again, I'm Jen Kozalina. We're going to start out with 2 sections, PAPRs as part of your respiratory protection program at your institution and deciding best respiratory protection tools for your institution from Beth Beam. Then we will work our way into PAPR Selection. We're going to cover the ILC Dover and 3M PAPRs, and that will be brought to you by Jackson Gruber and Morgan Schrader. And then we'll cover the MAXAIR PAPR system with Brooke Brewer and Brooke Henriksen. And then we will also talk about transport considerations with Bethany Little. We'll then move into the question and answer session, and then we will provide you with additional NETEC resources. We do have a short disclaimer, just that we wanted to mention NETEC does not endorse or promote any specific brand or manufacturer of PAPRs. The information provided today is meant to offer general guidance and education about PAPRs. And now I'll introduce Beth Beam from University of Nebraska Medical Center, Nebraska Medicine, to discuss PAPRs as part of the respiratory protection program at your institution. Thank you, Beth.
Yep. Thank you. So I'm going to just start by providing kind of an overview of respiratory protection programs as it relates to using PAPRs in your institution. If you're looking for the federal requirements of this, I just want you to know that it's fairly simple to Google the bullet you see under my first note there about looking for the OSHA requirement. That will bring up all of the respiratory protection standard pieces that you might be concerned about. So where might you find the respiratory protection program documents in your institution? There's no specific place, but typically it's managed by infection prevention. It may also be handled by safety, occupational health, or other emergency management roles, kind of depending on the size of your organization. The key elements of all kinds of respiratory protection programs is that it has a health assessment. This is required whether or not you're going to need to do fit testing for what we would typically think in healthcare as the N95 respirator. And then it should also include education and training. So it's important that if you have a particular device that your personnel are going to use, that they are educated and understand all of the components of using it. So that is laid out not only as something that you should do annually, probably as part of your competency trainings, but also content areas are laid out. So they should know how to set it up. They should know about cleaning and maintenance. They should understand how to don and doff the equipment properly. And they should understand if they need to wear this protection in concert with other personal protective equipment, how to create that ensemble and be safe. The nice thing about this, I would say, is that if you are looking about your institution and cannot find your respiratory protection program documents, there are a ton of resources out there for you. A lot of these toolkits and the questionnaire pieces, the links that I'll share with you are kind of like the the Mad Libs of safety. If you open them up and you work with those templates, more than likely all of the components you need are there. I don't recommend inserting random nouns and adjectives, but if you put in your personalized information for your institution, the toolkit will walk you through all of those OSHA requirements. And it's nice that they have them specifically, like I said, to really give you the examples of the medical evaluation questionnaire, and even have tools specifically for long-term care if you need them. Want you to recognize that risk assessment is a big part of this respiratory protection program, and think about that broadly. Today, we're talking a lot about special pathogen and biological, but know that your respiratory protection risk assessment should include all the hazards in your institution. Oftentimes we think about chem, bio, and rad in that situation. I want you to know that in most cases, the radiation type stuff does not require necessarily the N95 level of filtration for respiratory protection, but often chemical and biological do. So just think about, does your institution deliver hazardous drugs? Would you be responding to a chemical incident, say if a farmer was exposed to anhydrous or something like that? Do you have a decon team for that? Think about who in your institution then needs to have this protection. Care providers, people who provide essential services, environmental services. Creating that risk assessment and the who is really important. Same thing with biological. Think about all the different things in your hospital that generate risk in terms of particle inhalation, and then who in your institution needs to be part of this process of being part of the respiratory protection program. Remember that the PAPR ensembles can be used for these different risks, but sometimes there are situations where simply utilizing the N95 respirator and our typical standard precautions, personal protective equipment is also fine. It all depends on the risk presented. So there are PAPR models, some of which we'll talk about today, that can be used for chemical and biological. Just remember that the hoods can be very different, the filters can be very different. The nice thing is that you only buy the one motor for both applications, but the key to that is making sure that your staff understand the difference between when I would wear this outfit and when I would wear this one, and make sure that they understand which filters to utilize for those different roles. A lot of that falls into organization and such, but just recognizing and educating that is really important. I would tell you too to be careful not to bring a chemical PAPR or a biological PAPR to a chemical event. The protections from a HEPA filter or from the typical biological hoods would not be adequate for a chemical situation. Probably okay, vice versa. Just know that there are also post-event things that you'll have to deal with in terms of disinfection and stuff like that with those other materials. So just a lot of planning and working through those pieces. So again, our program today focuses on all the special pathogens components of this, but we wanted to give you that broader overview so that as you're investigating this as part of your healthcare respiratory protection program, that you know to look for all these other elements as well. All right, I am next slide. We'll move on to the next person.
I have the pleasure of speaking on our first PAPR ensemble today, and we will get started, and then I'll pass it off to Jackson to move forward from there. So first up is the ILC Dover or the Sentinel PAPR. This is a single platform that can actually be used for emergency response and decon, also infectious disease response and industrial chemical work. And so we're going to walk through some of the hood components, walk through some of the PAPR components, and just give you a broad overview of the capabilities of the ILC Dover. So the ILC Dover has 4 head covering options, and 3 are located here on this slide. There's the BioShield full hood, which is a disposable headpiece. There is the head cover and the clear hood. The unique thing about the clear hood is that it gives you a 320-degree view without any obstruction. And there is actually no restrictive pieces inside that hood. So it really rests and inflates using the material that the hood is made of. That hood, and along with the BioShield full hood, can be used for industrial chemical response according to the ILC Dover information. The head cover and the BioShield full hood can be utilized for infectious disease response. The head cover itself is, you can still use with your stethoscopes if, in emergency rooms potentially, or up on, hospital floors. It does use the same, blower tube or air tube that is used on all three of these hoods. And so there's standard accessories that can be used through all of these. And then it also can be raised up or elevated into the BioShield full hood, which is a completely different component, but adds an additional layer of protection as it encompasses the entire head itself, with dual shrouds, a cushioned headpiece that can be adjusted to wearers. And interestingly enough, the excellent of the wearer actually filters down into the suit itself. So with these three models, there is no fit testing required. But they should be selected based on risk assessment that's performed at the organizational level. The butyl hood is a CBRN which is used for CBRN, actually has an entire conversion kit that is capable. So you can still use the Sentinel blower motor, but you can actually transition it between infectious disease response or industrial chemical response into a CBRN capability with just a couple of swap outs of pieces of material. The butyl hood assembly has the breathing tube as a full unit, so it's not two separate components. And then it also requires specific cartridges into the application. The unique thing about this is for the wearer, they can use it in a backpack fashion or the quick release belt fashion. And so just based off of comfort or maybe activities performed for that responder, they can either wear it in a backpack fashion or that belt fashion. Uniquely enough, also, that backpack can be used to store all the supplies for response. And so when we think about readiness, this is maybe an option for those decon teams or responders to have all of their supplies ready to go in that backpack. And that way they can just grab a backpack and begin to don their personal protective equipment. But with that, consideration should be made to make sure that there's checklists to make sure they have all of the components necessary. So let's talk about other components. That breathing tube is a ridged plastic helix that actually has the ability to have a plastic overlay depending on tasks being performed by the wearer that can be secured or removed, and it's just secured with twist ties. So that's something to look at, that helix, that plastic breathing tube. That breathing tube, again, is utilized for 3 out of the 4 hoods available through ILC Dover. For just recognition of how many different pieces do I need to have on site to provide different levels of response. There are 3 different filters available for the ILC Dover Sentinel PAPR. You have the CBRN cartridges, you have the HE cartridges, or filters, I apologize, and then you have the OV, AH, and HE cartridges that are, again, each have their unique response and capabilities to provide that higher level of respiratory protection. The blower motor itself is constructed of nylon. It is a rigid motor that has dual chambers to provide that durability. There are 3 cartridge or sites of which ILC Dover can have cartridges on. There is a bit of education and training on this, as is for CBRN and chemical response. They require 3 cartridges for this model, but for biological and infectious disease response, there's only 2 cartridges. So making sure that the wearer knows to always validate and verify that that 3rd cartridge hole is covered with a cap. Otherwise, there is an increased risk for improper use. With each of the PAPR motors that we'll present today, there is an associated noise level that should be taken into consideration for communication techniques and communication education and training, as you identify which motor or which ensemble you feel it would best fit your needs. Specifically to this design, if your motor or your blower is not functioning properly, there is a low voltage alarm and flashing red light that happens at the back side of your motor. It is an audible sound that is just there, but making sure that your team recognizes that if you see a flashing red light, and whether or not you can hear specifically the low voltage alarm, that is an area of which the wearer needs to be removed from that situation. The belt is can be used for all three of those responses. Again, we kind of just visited in this, or the backpack option. And each of the Sentinel blowers come with an airflow tester that should be utilized once all of the filters are applied, and especially with that biological, that third application area has a cap on it. So there are three options for battery or for charging capabilities with this, or to power this Sentinel motor. There is a rechargeable battery pack that can actually be the motor itself can be charged while either pre-positioned in the backpack or pre-positioned on the belt there. You will see a green red light LED that let you know that if it's charged or fully charged, and that battery life should last about 8 hours. There is a weight associated depending on which option you choose. And so for the rechargeable battery, whether it's the rechargeable battery option is about 1.6 pounds, but the 5D cell option puts a couple extra ounces on there, and it's almost close to 2 pounds. You do have a longer charge with the 5D cell batteries, which will last you about 10 hours. But this is all variable based on environmental considerations and a number of filters that you're using at this time. The third option for charge is a 10-year lithium non-rechargeable battery option that I did not include on here. Their considerations, for that are tracking when the batteries were purchased, when they're used to monitor that 10-year shelf life, but also those batteries last only about 10 hours on that as well. So just another consideration for the ILC Dover options for power for their Sentinel PAPR. So how do we clean and disinfect it? So we've selected our items, we've created a donning and doffing order, and then we have to figure out how are we going to clean and disinfect the PAPR components. The great thing about ILC Dover is they have a wonderful user's manual and instruction for use on how you should interact with each of those components, whether it be single use only, cleaning and disinfection options as well. These are just a few of the general overview components of the ILC Dover, but just really want to reinforce, make sure that you always reference the user's guide and the instructions for use. This PAPR Sentinel blower motor cannot be submerged at all, and so that's one thing that I wanted to highlight today. It is, others potentially can be submerged, and so just taking that into consideration on how you want to manage post-use of the ILC Dover. With the cartridges themselves, again, using the IFU and the user's guide to guide that, cartridges should be handled, as contaminated or potentially contaminated objects, and follow that the discarding of those items according to local state environmental regulations. So making sure that you do spend some time to identify a process that meets both the instruction for use and other guidance that could impact that. So what are the pros and cons of potentially selecting the ILC Dover? The pros is it has a variety of uses. There's quite a few PPE configurations, and so you can use the same motor to respond to, chemical events or industrial chemical events. Your decon teams can utilize it, and then your infectious disease response teams could potentially use that. There are a variety of selectable hoods that can be used in combination based off response. And there are flexible charging options, whether you want to use the 5D cell batteries or the rechargeable battery option or the lithium ion battery option that's also out there as well. There are select items that can be reusable, which can potentially help with impact the financial burden of these PAPRs. Other considerations should be like the more components, as alluded to Beth, and Beth spoke about, the more education and training. A really robust education and training plan should be deployed for any of the PAPR selections that are presented today, on making sure that people recognize when hoods should be utilized, when certain filters should be utilized, how we perform airflow tests to make sure that the PAPRs are running accordingly, and all of the safety considerations for that. The flexible tube can potentially pose a risk. It does stand out in the back. This is just a nuance of the ensemble itself. And so you want to make sure that your staff and team members have education and training about just be environmentally aware of the space of which you're working that can, potentially get caught on. If you're not using the clear hood, there potentially could be a diminished field of view. Remembering that that clear hood does offer a 320 degrees of view, but can only be used in industrial chemical response and not necessarily in biocontainment response. There is no alarm if the filter is not in place. And so when you run your airflow test at the beginning and you maybe skipped a step of validating and verifying that that cap is on the bottom of your motor, that will not send an alarm for airflow. Your airflow test will pass. So just again, making sure you have a robust education and training program around understanding the PAPR nuances themselves for that Sentinel XL. And the battery charge is not shown. And so the battery alarm will low when there is low voltage. And so again, making sure your team has that recognition of when we see that flashing light or when we hear that audible sound, we need to have a plan to remove that responder in a safe and controlled fashion. And so they're not losing their airflow. So with those considerations, I will transition it over to Jackson to present on the 3M.
Thank you, Morgan. Again, I'm Jackson. I'm going to be overviewing the 3M VersaFlow PAPR systems. From these systems, there is the TR300, the TR600, which is the one that we are going to primarily be overviewing today, and then the TR800. When looking at the VersaFlow systems from 3M, there's really two main types of hoods that can be utilized. There's disposable hoods, as you can see on the top in those white hoods, and these vary from single shrouded to double shrouded to even half hooded PAPRs. A lot of the components on the insides of these hoods can be changed as well. For instance, on the two white PAPR hoods on the right-hand side, you can see an integrated head strap. On the one on the left, you cannot see that integrated head strap. So there's a lot of different variations between these various types of hoods. The second type of hood is a non-disposable hood or a reusable hood. That hood can be found at the bottom right-hand corner of your screen. Typically, these reusable hoods are used inside of industries such as metalworking, woodworking, construction, and areas with overall high particulate matter inside of the air. Again, these hoods are built for a reuse strategy, and we would not recommend to utilize these hoods in a high-level isolation. Awesome. So the 3M TR600 components. So overall, we're going to start with the PAPR blower motor itself. This is what actually brings the air through that filter up to the individual who is wearing that PAPR. On this blower motor, there are two main buttons. The first button is obviously the power button, and this turns on the PAPR blower motor. The second button is actually the flow button for that PAPR. So with this model of PAPR, you're actually able to change the variable flow rate that you want to receive as you're wearing that PAPR. There's a bunch of different indicators on this PAPR blower motor as well. So for instance, at that bottom of the left-hand portion of the screen, you can see there is a light next to that fan button that indicates the level of air that is being pushed to the individual who's wearing it. You can also see a battery bar. This indicates the amount of power that is left on the battery. And that one that kind of looks like a stadium or a dome, this is actually indicating the filter health. So for instance, if that filter were to become clogged or dirty, it would actually drop those bars until it gets down into the last bar, which then it would in turn red and then alarm. Additionally, with the TM600 or TR600 PAPR blower motor, there are various alarms that can occur as well. So obviously you have visual indicators, you have vibratory alarms, but you also have audible alarms as well. Say for instance, if you wanted to clog the connection of where that PAPR blower motor connects to the breathing tube, you would receive an alarm just because there is a drop in pressure inside the system, and it's going to indicate that to the individual who's wearing it that this PAPR is not operating as it should. And as Beth mentioned in her RPP slides, different cartridges and PAPR filters are made differently, and they serve different purposes. For the TR600 PAPR specifically, you are able to utilize, if you choose to do so, a pre-filter. And this helps extend the life of that HEPA filter by collecting large particles prior to it actually entering that HEPA filter. Then you have your HEPA filters, and these are high efficiency particulate absorbing air filters, and these collect particulate matter within the air. And this obviously protects the wearer from those contaminants if worn properly. we're going to jump into some more components of the TR600 PAPR blower motors from 3M. So first we have our breathing tube, and obviously this connects to the PAPR hood and the PAPR blower motor, and it is really that transition that allows for air to flow to the PAPR hood itself. With the 3M design, it can be really easily connected to the PAPR blower motor by squeezing those red clips, inserting and turning 1/4 of the way to the right. Next, we have the belt, and obviously this is utilized for securing the PAPR blower motor to the wearer. 3M also offers belt extenders if you need to have a little bit more room to connect that to that individual. If you kind of look at that photo right above the battery, you can see that there is more, that is the comfort style belt. There's also a not comfort style belt, but we utilize that comfort style belt, which has a little bit shorter of a clip to actually secure it to the individual. Next is the airflow tester, and this should be utilized every single time that you're going to be donning and using that PAPR blower motor. This is used to determine whether the PAPR is functioning appropriately. And as Morgan mentioned inside of her presentation, the filter should be in place prior to performing this airflow test, as that filter is going to provide resistance. And then lastly, the battery. This is obviously used to power the PAPR blower motor. Typically, these batteries run between 7 to 10 hours with a standard battery and 10.5 to 19 hours with a high capacity battery. Obviously, the battery life will depreciate over time and is kind of subject to the use of the PAPR blower flow setting on the device. What you're seeing on the screen now is a side-by-side comparison of the 3M TR300, 600, and 800 PAPR systems. Like I mentioned earlier, we are really going to be focusing in on that TR600 PAPR, but this can be utilized to make a better informed decision if and when your facility chooses to identify potential PAPRs for respiratory protection. Cleaning and disinfection, so a very important process inside of donning PPE in general. So obviously, all this information was pulled from the instructions for use, the user guide from TR600, or from 3M. So cleaning is recommended after every use with any disinfecting agents. Please follow the instructions for use. You also want to make sure that each component is thoroughly rinsed and cleaned with warm water thoroughly and dried before it's put back into storage. And then from a cleaning perspective, you want to make sure that all of the gross contamination is removed from that device prior to attempting to disinfect. In the disinfection process, you want to make sure that you are using an approved disinfectant. And something to note with the 3M VersaFlow PAPRs is that these PAPRs can actually be submerged for cleaning and disinfection. It is important to note that you should utilize the TR653 kit just to make sure that all those internal components are protected prior to submerging. Awesome. So we have some benefits and some considerations for the 3M VersaFlows. Some of the benefits are that it is a smaller profile compared to other PAPR blower motors. What this is really trying to say is that whenever the wearer is wearing that PAPR blower motor, it is not extending. The depth in which it is extending is not greater than the ILC Dover. You also have access to information while wearing the PAPR, like your airflow settings, your battery health, and your filter health. Additionally, there's various options for cleaning and disinfection of this PAPR blower motor. Furthermore, there is reduced weight as compared to other models of PAPRs, and then usability across biological and chemical threats. But I really want to focus in on the fact that you should not utilize a HEPA filter for a chemical response. Some considerations for this PAPR are there's more components to assemble. This requires individuals to become very knowledgeable with the device that they're using, and it also requires facilities to create SOPs that denote what that process is and how it is to be completed. Another consideration is the flexible breathing tube. This may require for additional control whenever doffing to prevent inadvertent contact. And the last consideration is, depending on the hood style, this may diminish the field of view of the wearer. And this is really more so getting at the exterior shroud of a double shrouded hood from 3M. If you're to bring your arms up, there's a potential that could rise up and block that view.
Thank you so much, Morgan and Jackson. And we're going to turn this over now to Brooke Brewer from University of North Carolina and Brooke Henriksen from Providence Sacred Heart Medical Center and Children's Hospital in Spokane, Washington. Take it away, Brooks.
Thanks, Jen. My name is Brooke Henriksen, and I am the nurse educator for the Region 10 Treatment Center for federally funded treatment center, excuse me, sorry. And we're going to review the PAPR selection of MAXAIRs today. So the MAXAIR that you're looking at here, I think this is what we see a lot. One thing I want to clear up is the difference between the CAPR with a C and the PAPR with a P. I feel like there's a lot of confusion out there. We are mostly referring to PAPRs. MAXAIR wanted to do, I guess, their own little take on things. And the CAPR is the same thing as a PAPR, but it is their brand name. So it is the controlled air purifying respirator. It is the same functions of a PAPR. It just has a few different variations that we'll talk about today. What we're seeing here is a PAPR that I think we have used most often for what maybe our airborne pathogens such as COVID. The front, the lens cuff is disposable. What we have seen is you can reuse that for an entire, maybe potentially a shift, wiping it down in between each use if you're removing that between entering the room. There is underneath this hard shell where you can see on the helmet it says MAXAIR. That is a hard shell. It's called the filter cap cover. Underneath that is the XP filter. That is a removable filter. That is NIOSH 99% HE efficiency, and that has multiple uses. So when we know that filter is needing to be changed with all of the MAXAIR helmets, when you look up, when you have it on, if this person in the picture were to look up, she would see lights up above that is right above the forehead on the helmet itself. And those lights denote either battery life, those are the green lights, and those are 3 green lights denoting battery life. Yellow denotes the flow through the filter. So you know if you're seeing a yellow light, your filter underneath that hard shell would need to be changed because it's not necessarily filtering at optimal levels. If you're seeing a red light, that is denoting your battery life. MAXAIR does not have any audible alarms. It is all visual, and it is all based on what you can see when you're looking up through that filter or looking up through in your visor up on the helmet. The one thing with this difference is there is a battery that is worn around the waist, and you can see the cord coming off of the back of this helmet. The fan is right behind her in that helmet. So rather than wearing the filter and the fan on the waist, as we have denoted in the ILC Dovers or the 3Ms, this filter and the fan is actually in the helmet. So there is a little bit of noise. 62 decibels. They say it's almost always below 62 decibels on their different ratings, and we've looked through them, and I think they usually are right around 60 is what they're talking about and lower. The typical system weighs about 2.5 pounds, and that includes the battery around the waist as well as the helmet. So we have found that they're fairly light. And again, we've used this, what I've seen this used mostly for is respiratory viruses and certainly through COVID. This ensemble we have seen this in biocontainment units as well. So this ensemble still has the disposable filter underneath that hard shell. And then there is a full PAPR visor with the shroud. So this would be used for instances when you want complete skin coverage. It does protect the head, face, and neck. Again, it is still the HE XP filter underneath that filter cap cover, so it still has that high NIOSH efficiency rating. The shroud is completely disposable. So that would be a single-use disposable shroud. It again can be used in a biocontainment situation here. One consideration I think you would want to consider is who's going to change your filter underneath that filter cap cover if you're in a biocontainment situation. So doing a risk assessment, knowing who's going to change that. And as I believe Morgan had already mentioned, those filters are then considered contaminated. So you would want to have a risk assessment and a very thorough and careful filter changing process. This outer shroud does have a level 4 fluid impermeability rating. So you do have good fluid and permeability, and the filter is already protected with that filter cap cover. This is also a filter ensemble we would see in a biocontainment rating or in a biocontainment situation. The difference with this is the top, you can see that's a soft shell rather than the hard shell. So this hood ensemble has the filter incorporated in it. This is also single use. It is disposable after one use. The heavy loaded filter is what you see that's written on MAXAIR, and that is giving this filter ensemble the combination between that filter and the inner filter is giving it the HE level rating that we need from OSHA. It does again provide full head and below the shoulders coverage. The shroud below the filter, so basically below his forehead area, is all level 4. And the filter underneath that heavy loading filter is level 3 fluid and permeability. These come in both double shrouds or single shrouds. If it's a double shroud, the inner shroud would be kept inside either the coverall or the gown. If it's a single shroud, then the outer shroud is just on the outside. This is actually what our team uses. We do like it. And again, everything comes off with single use. So you don't have another filter that you need to concern who's going to change it and when is it going to be changed. This whole ensemble, this whole filter with the integrated hood is single use only and comes off pretty easily. So this ensemble is very similar to the one we were just looking at. The one thing they have added is the high fluid resistance cover cap, which is a hard shell plastic cover that goes over the ensemble we were looking at in the previous picture. So this provides fluid resistance, a higher fluid resistance because it is a hard shell. Again, we still have the full head and below the shoulders coverage, and you get complete splash and fluid protection from this filter with the same high efficiency rating for NIOSH. I have seen these in biocontainment units. When they remove that hard shell on the outside, that portion may be decontaminated and reused, but everything under that, with the filter and the hood ensemble, that entire portion is disposable. This is just a standard or a side-by-side comparison with the top bar here. We won't go into too much. This filter with the hard shell was the very first picture that I was referring to, where there may not be a hood. So there are 2 different battery lives. They're about the same size. The battery for the standard battery is about half a pound. It lasts 8 to 10 hours on a full charge. And the variation just depends on the 3 fan speeds, which I apologize. I neglected to mention that there are 3 fan speeds with the MAXAIR helmet. And the fan speed you can select based on whether you are somebody who gets very warm or maybe you're somebody who gets dry eye. The fan speed does not affect filtration whatsoever. The extended battery life, that's a little bit bigger of a battery. You can get up to 12 to 15 hours battery life, again, depending on your fan speed. And we discussed the filter lights and the indicators already. So again, that top is the filter shell with just the lens cuff where you do not have a hood. The consumables are certainly the comfort strips that go right around on the forehead that are not visible from the pictures. The disposable lens cuffs that can be used for the day per wearer. And then of course the filters underneath that hard filter cap, if that's your ensemble. The second list here, where it's other variations with the filter hoods, the battery life is the same. You again still have the 3 speeds with the helmet. The filter lights, if it's yellow, that's denoting that the filter needs to be changed again, and the green lights denote your battery life. The difference here with the consumables is you would have your single filter and shroud ensemble is disposable. Some of the hoods or some of the shrouds have the filter incorporated in the hood itself, and some of them they're separate. So knowing which ensemble you have, and as previously mentioned, there are multiple variations with all of these, with the MAXAIR, the ILC Dovers, and the 3M. So having a really good training program so that your personnel are familiar with all of the components is really important. I'm going to turn this over to Brooke.
Hi, thank you, everyone. My name is Brooke Brewer. I am program manager for our treatment center site at University of North Carolina Hospitals in Chapel Hill, North Carolina. And working with Brooke to talk about these MAXAIR CAPRs. So I'm going to review some cleaning and disinfection that we do with the MAXAIR CAPRs. And these cleaning and disinfection protocols did come from their manufacturer's instructions for use, which we always recommend to refer back to when looking at cleaning and disinfection. MAXAIR recommends to use the PDI Super Sani cloth germicidal disposable wipes or the Clorox Healthcare Hydrogen Peroxide Cleaner Disinfectant when cleaning their hoods. And general guidance would include wiping all areas of the outside and inside of the capper helmet, battery, cord, and battery pack, and then allow the disinfectant to remain wet per the manufacturer's instructions for use. All of the filters, cuffs, shrouds, and hoods are a one-time use only and should be discarded after use. So we don't, the hoods and shrouds, we don't reuse them in clinical settings and should be disinfected. These hoods are nice for cleaning because they're fairly easy to clean. It's a smaller surface, and just making sure all of the surfaces within that helmet are wiped effectively also. And then some pros and considerations for choosing or utilizing a MAXAIR capper helmet system. Some of the pros include that this is a no-hose system, which eliminates the chance for snagging and increases your ease of movement when you're moving around a room. There's not the bulky backside kind of component. Your cord, especially in a biocontainment unit type setting, your cord for the battery is very thin, very much like a cord for your phone or whatnot, and can go just inside your suit. Various options for cleaning and disinfection, quaternary ammonia, bleach, etc. It's a versatile system that can be configured into a cuff, shroud, or hood depending on your situation, and Brooke was able to go over the several different systems that are available. It's also a fairly lightweight system with a helmet that's very similar to wearing a bicycle helmet and a battery pack that's attached to the waist. So it really just clips onto your pants and is fairly light. And there's a visible light display for battery life and filter life that Brooke went over, and you're able to see just at the top of the helmet right there. Some considerations when choosing this system: there could be considered to be diminished hearing ability with the noise from the blower or muffle of wearer's voice. So communication is a big thing to think of when you're using these capper systems, and just making sure that your wearers are speaking up and looking directly at one another when they're talking to each other. Occasionally, wearers may find the helmet uncomfortable after prolonged use due to the headgear component. So like I alluded to, it's very much like a bicycle helmet, and so ensuring proper fit is very important. There's a spot on the back of the helmet that twists just like a bicycle helmet to make sure it fits, and it's important to make sure that the helmet is going on so that it is not too tight on your head and you are able to remove that. And making sure those comfort strips that Brooke talked about are changed out on a regular basis also. And those provide some comfort to the front of the helmet where it rests across your forehead. I think that might be the rest of my slides. Yep, and I will hand it back over. Thank you.
Thank you so much, Brooke and Brooke. We're going to turn it over now to Bethany Little from MedStar Washington Hospital Center. Thanks, Bethany.
Hello, everyone. Thank you, Jen. My name is Bethany, and I'm going to walk you through the transport section of this. Okay, so we just had a really great overview of 3 different PAPR systems. And just to review, all the PAPR systems have a motor or blower, a power source, a filter, and a hood configuration. But as you can see, the way these components are configured vary amongst the different PAPRs. In this section, we're going to explore the various considerations of using PAPRs as they relate to donning, doffing, and wearing during transport. So during donning during transport, you have to consider your space. Unfortunately, with transport, you don't have one special space you will be donning your gear. You might be going to a facility for pickup, or you might be going to a person's house for pickup. What does it look like for you to be able to put things together to prep your PAPRs to be ready to wear? Another thing to consider is assistance that's required during donning. Does your current donning process require you to have assistance? If it does, and that's a problem, is there ways you can make it a self-doffing process? Again, these are both just things that are plan and protocol dependent, and you just might have to make considerations for how you're doing it. Wear considerations. One of the unique things about transport is you're going to be out in the weather and you're going to be exposed to different weather conditions. You need to make sure that you're staying safe and that the PAPRs are staying safe. One part of that is your hood and shroud configuration. Most of these systems have different hood and shroud configurations. What you need to figure out is, are they safe in adverse weather, and how much adverse weather can they be safe in? This is something you need to touch base with the manufacturer on to determine what you can and can't use. The second part of that's the actual PAPR components, the motor, the power source, and the filter. These are located in different places on different systems. But if they are exposed, is that okay? And to what degree, again, can they be exposed? If you're thinking about covering them, that may be fine. You should also look with the manufacturers on that as well. You have to remember, these are not SCBA. It's not a contained source. It's pulling in air from the atmosphere that you're breathing through a filter. So you want to make sure that you still have the ability to pull through air. So if you are going to cover them, just make sure you're conscientious about how you're doing that. Another wear configuration is some of these PAPRs, this actual blower motor is worn on the outside of your PPE, whereas others like the MAXAIR, everything's worn inside. One of the big parts of this is your ability to troubleshoot. So the 3M and the ILC Dover, as you saw, you wear on the outside. Should you need to troubleshoot those or maybe change out a piece, you might be able to do that. Unfortunately, with the MAXAIR, it's all under your PPE, so it can be a little bit more hard to troubleshoot, and you may potentially have to doff out to do that. On the other hand, as was mentioned, the tubing on the outside has the ability to get called on stuff. Again, this just needs to be put into practice and being conscientious of your surroundings. Whereas the systems that are worn internal, like the MAXAIR, everything's inside, and it's a little bit safer that way, just maybe a little bit harder to troubleshoot. Next thing we want to look at is the transport environment. So again, this is a unique space. It's a confined space usually, a little bit less moving around. How does your PAPR sit on you? Do you have one of the backpacks or waist belts? Or do you have the helmet on? You're sitting likely, which is different than being in a healthcare facility where you're standing most of the time. So are you able to sit with your PAPR on comfortably? Are you able to safely readjust your PAPRs while you're sitting? Leaning over the patient while working is a different mechanism than in the hospital. So you're kind of leaning over a little bit more, maybe reaching over. And how does your PAPR sit on you as you're doing that? Is it comfortable? Is it pulling on you? It's just different things to consider with the helmet and the waist packs in that part. And then your length of time. How long can your crew be in PPE and be comfortable? Not going to be completely comfortable, but we want them to be okay. And transport times can vary. You'll know within your region or facility or areas where you're transporting how long that looks. Some people are short transport times, even a 15, 20, 30-minute transport time. You're going to look at the crew being in PPE for about an hour. So those who are doing longer transports are going to be in PPE for a considerable amount of time, possibly. Another big thing to look at is communication. So as we heard with these other PAPRs, communication can be difficult just in the PAPRs alone because of the blowing of the air and the noise generated from the PAPR itself. Transport in and of itself has transport noise, whether it's from vehicle or aircraft, and can make it harder to communicate. The two combined can really put a stressor on the communication. If you're using radios already, you just need to make sure that the way your radio is configured will fit with your PAPR configuration, whether you're wearing your radios inside your PPE, outside your PPE, does it go over your head? Maybe the helmet won't be a good consideration versus stuff that you're wearing on a belt. You already have a belt on. You just want to make sure that it all works together. You might need to make some changes. Also, if you're not using radios, it's something you might want to consider looking into if you find that it's too difficult to communicate in transport. You need to be able to communicate with your team members, but you also need to be able to communicate with the patient. And as Brooke was saying too, it sometimes just being conscientious to look at the person you're talking to can go a long way into helping your communication. Another part of this, though, is your ability to hear indicator alarms. So this is on both the PAPRs themselves and the patient monitoring. This might just come down to writing into your protocols of making sure you're monitoring stuff, making sure you're looking at stuff. Some of these alarms you have to look at visually anyhow. Some of the audible alarms you may or may not be able to hear in transport, so you might have to make it a part of the process as to where your team's looking at them periodically. Lastly is the doffing considerations. Unfortunately for transport, you don't get one doffing setting as we do in the hospital. You may be going to various different facilities to where you'll end up doffing. It would probably be a good idea if you have a set group of facilities that you know that you potentially be doffing at, reach out to them so you can practice this and understand how you want this process to work for your team. These settings will be unfamiliar, and you could potentially be in a confined space or just an abnormal space. Unfortunately, if you needed to doff en route to a hospital, possibly on the side of a road or something, that's another possibility that might happen for transport. And you really need to have very strong doffing processes in place. Remember, doffing is a high risk process, and we want to make sure everybody remains safe throughout it. Other pieces you want to look at are, and this is just how your plans and protocols work. Do you need a doffing buddy? Do you use tools to doff, such as a chair or an IV pole? And it's absolutely fine that you use them, but you want to know if you are in a place that you're not familiar with, or heaven forbid on the side of the road, do you need these tools? Do you have them available? Will a doffing buddy always be available? If not the case, you need to come up with plans in your protocol on how you will deal with that safely, maybe creating a self-doffing process. And the last thing you have to do is, if when you are doffing, if it's not in a hospital or a facility that's able to take your equipment, first of all, you have the disposable equipment, but then also the reusable equipment, and how you're going to store it and wipe it down and clean it and get it back to your facility needs to be a well-written document and plan for your crew. Thank you.
Thank you so much, Bethany, and thank you to all of our panelists. I just wanted to point out, we're not going to review this slide. I know we're running short on time, but this slide will be available in the deck. Just a comparison summary of the PAPRs that we talked about today. So we're going to move on to the questions and answers. We are running short on time, but there was a question that came up several times that I thought I would pose to our panelists. There's a few questions about the filter shelf life and when to change after use. Specifically, other than the 5-year shelf life, how do you know when to replace the filters when they are used? Is there a certain number of hours before they need to be changed? And how do you track hours? Does anyone want to answer that?
I can start and I can let others fill in after. So from a 3M perspective, their instructions for use state that the filter should only be changed if it is wet, damaged, or if it does not pass the flow test verification. And this is pretty common because inside of hospital settings, there's typically not a large amount of particulate matter that is getting caught inside of that filter, requiring it to be changed. I hope that answers your question.
Yeah, that doesn't surprise me. I can tell you that when Ford made PAPRs for the pandemic, the filter was permanent. It was not something that was even changed as part of that device. And so that's fairly common. Remember that the healthcare environment is fairly clean. You're not likely in a very dusty environment. So those filters rarely get clogged. The key component with more of the canister type filters is if you do need to clean and disinfect that, you need to be really careful that the disinfection solution isn't getting into the filtration material in the holes. Because if that sort of thing happens, then you have moisture and more risks to think about. But for typical healthcare, the HEPA filter should last a very long time. I think in our general practice in our biocontainment unit, we've talked about kind of a standard of 30 days. If something's been used that long, that would make sense to throw away. But in general, like I said, the filter should function well.
Thank you both for that. It looks like we are just about at time. We do have a record of the questions that were asked, and we will do our best to answer those in our blog post that we'll also be sharing with you. But we do want to make sure we take the time to put thought and consideration into those responses. So before we close, Just remember that NETEC offers support and services, and you can contact us at info@netec.org or fill out the Contact Us form. We offer many services that you can explore on our website, NETEC, at NETEC. And we are here to help. Again, you can submit technical assistance requests at netec.org. And we are happy to partner with you and connect you with the subject matter experts that can help you out. Also, be sure to find us on social media where you can hear our NETEC podcast, look at NETEC skills videos, and access the NETEC e-learning center. And lastly, I want to thank you again for joining us today. And please, again, thank you to our panelists, and thank you all for your time today.